changing lives.
Hello, good evening. Welcome back on Hope TV. This is Healthy Living. My name is Bibi. Yes, today is Monday and we are on, as usual, with issues pertaining to our health. And today we are talking about COVID-19, some aspects of it. You would agree with me that recently numbers of cases of COVID-19 is rising and Ghana has not been left out. And we find it important that we discuss issues that are surrounding COVID-19. And today we are here to discuss our mental health and COVID-19. You would see that there are a lot of issues that are going on as a result of this pandemic. People are depressed, people are anxious about news about COVID-19, death here and there. So we thought that we need to give our viewers something to educate them and to talk about. And so I'm here today. As usual, we have professionals who will take us through the topic for discussion. The first person I have, we don't have the usual panel in the studio. They'll be joining me on Zoom. I have two panelists. The first one is Mr. Philip Ofori to me. He's a psychiatric mental health nurse practitioner. Hi, Philip.
Hello, Bibi. How you doing?
I'm doing well, thank you. How about you?
Just by His grace.
Right.
I'm doing great.
Right. And how has your day been? I know that where you are, the time difference is about 5 hours.
Yes, it is.
Yeah.
And my day has been good. Thank God I'm off today, so this is an extension of my weekend. So I've just been enjoying the day so far, getting ready for our viewers. And I want to welcome everyone to the show today.
Right. I envy you for your off day.
I'm going to have longer Monday, I have Tuesday, Wednesday, Thursday, and Friday. So, yeah, I don't think you want to trade that.
All right. All right. So the second person we have is Mrs. Paulina Inketia. She's a psychiatric health nurse. Hello, Polly.
Hello. Can you hear me?
Yes, I can hear you. Good evening.
Okay.
And how are you doing?
I'm doing fabulous. I hope you're well too.
I'm doing well, thank you. And how has it been for you as a mental health nurse with this COVID-19? How are you holding it up?
It's not easy. Those who are perceived to be normal are not even adhering to the protocols. So you can imagine. It's a big challenge, but interestingly enough, our patients are doing well. Just a few have had the infection, and so we're managing. Yeah.
All right. Thank you so much for that. So we will delve in straight away to our topic for discussion today, which is mental health and COVID-19. I would ask you first, Philip, how does COVID-19 affect our mental health?
Thank you very much, Bibi. So, as we are, anything at all that alters our mood, that alters our way of life, will impact our mental health. Therefore, with COVID-19 and its alteration to our daily activities, to our well-being, will definitely affect our mental health also. So part of how it's affecting our mental health is we are used to our normal psychosocial support system. And when I say psychosocial, for the sake of our viewers, please permit me to explain that. So we have our mind, which is the psych part, and then the social being of us, which is the social activities that we engage in, such as going to church, going to school, playing with our friends, going out on the weekends, weddings, stuff like that. So those are our social activities, which helps our mental health. So now with COVID-19, some of these things are taken away from us for our own safety. With it being taken away from us, which means that those normal psychosocial support systems or psychosocial support activities which we engaged in that helped our mental health is now taken away. So now two things are going to happen. Either if you already had a mental health condition, now it's going to be exacerbated. So it's going to be more serious because those support system is taken away. The other thing also is if even you did not have it, or you had an underlying condition, but it was not shown, it was not seen, because these things were covering it, were taking care of your mental health condition. Now that these things are taken away, then you're going to be exposed, right? So with COVID-19, it is exposing most of us. And as we go on, I will give you some of the examples that I believe that is making it challenging for us.
Thank you so much, Philip, for that. To Paulina, I think Philip has explained a lot into details how this COVID-19 is affecting our mental health. Could you outline, since it's your field, could you outline some of the issues or some of the conditions that has resulted as far as COVID-19 is concerned?
Well, thank you. We should know that recent research is showing a significant increase in the mental health issues all over the world as a result of COVID-19. An example can be anxiety, we have depression, we have other forms of anxiety. For example, we have the obsessive compulsive disorder, which is very, very likely to happen, especially if you always have the compulsion, you have the urge to wash your hands. And you know, COVID-19 is also telling you to wash your hands frequently. So the more you do this, it becomes more of a habit. But for people who have obsessive compulsive disorders, or they're just naturally obsessive with things, they end up doing it more than often. And this can result in anxiety, and then they can be diagnosed as having a mental health disorder. They are enormous. I mean, we have increase in violence against women and children. We can just name a lot that is happening all over the world, both in the social and economic aspects of life. And this is also affecting our mental health.
Thank you so much for that, Paulina. So as you've outlined the issues that affect us mentally, I would want us to delve into details one after the other. And also talk about, I know that there are people that are abusing drugs as a result of this COVID-19. People are undergoing stress and also a whole lot of things, as you already mentioned. Let's talk about depression. And I'll ask Philip about this. Could you talk to us about depression and how COVID-19 can lead a person to getting depression?
Okay, so let's start with this. Depression is one of the leading mental health conditions in the world, okay? Before COVID-19. So now, due to COVID-19, the cases of depression has been on the rise, and it's understandably so. As mentioned earlier, the psychosocial support system, which compensated, which helped us to manage our depression, is now not there. So it's easy for one to go into a depressive mood. Some of the symptoms of depression is someone who doesn't have interest in doing things, someone who is sleeping too much, someone who is not eating well, and then someone who just don't have any motivation. Then sometimes it gets to suicidal ideation, okay? So now let's look at with COVID-19, what has happened to us. We are told to stay indoors. Let's now engage in social activities. Let's make sure that we are putting on our face mask and all of that. So what that is doing to us is encouraging for us to isolate, which with someone who has depression, they tend to isolate. So it's also encouraging us to sleep more. which with someone with depression tends to sleep more. It's also encouraging us, really it's not encouraging us to eat more or not to eat more, but what we tend to see is out of boredom, people being at home, then they turn to food as refuge. So by the time you realize, you start putting on quite a few pounds here and there, and then by the time you get to yourself, then you're like, "Ooh, I've gained too much." Then it also starts to affect your mood if you are conscious of your body image. Okay, so this is part of how mental COVID is impacting our mental health, and in this case, depression. Let me give you a personal example. When COVID first hit the state in March, we were asked to work from home, and as a practitioner, it means I had to do telehealth. So I happened to work from my basement, and in my basement where the office is, there is no, sorry, can you hear me? Hello, can you hear me?
Yes. Philip, we can hear you.
Okay, so with where my office is, there is no natural light coming in. So with me working from home and working from the basement, after first week, I was like, oh, that is so nice. You know, I get to work from home, get to be with the kids and all of that. Then by second week, I started feeling not too well. My mood was suppressed. I wasn't feeling happy about myself. Then I realized that something is not right. Something is going wrong. We so often tend to teach people about what to do, but when it comes to practice, we really don't practice what we teach sometimes. So in this case, when it happened, then I had to quickly come up with some interventions to help me get out of that state. And when we come to the point of, you know, how we treat this problem that we have in our hands, I will talk about some of the ways that I dealt with it. So to your question, how is COVID-19 impacting us and affecting us to have depression? These are some of the reasons or some of the ways that COVID-19 is making us depressed.
Now, I would ask you, you will see that in our everyday lives, we use the word depression as and when. And
Loosely.
So, what are some of the signs or symptoms that one will see that will alarm the person that I need to seek for medical help in terms of depression?
Okay. So first thing, for you to know that there is a variance, you have to know the baseline. So first of all, I always tell people, know yourself, because symptoms present differently for different people. Someone will be depressed and tend to eat a lot. Someone will be depressed and will not be eating as much. Someone may get depressed and will be sleeping so much. Another person may get depressed and not sleep as much. But then one thing that is very common is loss of interest in doing things. So you don't have the energy, you don't have the interest. So let's say if, you know, let me just pick a name. Let's say Solomon loves to sing at church, and then he goes to church and you realize that he's not engaging in singing activities. Then you realize something is not right. So that is a loss of interest. Let's say somebody loves soccer. So whether they are playing or engaging in the discussion about football, and then you realize that they are not engaging as much, it means that they're losing the activity in the sport or the thing that they had interest in. So once that you realize there is that loss of interest, then there might be a sign of depression. Now, the question to when do you seek help? Whenever you realize that it's affecting your activity of daily living, your ability to make rational decisions, your ability to make safe and sound decisions about situations. When you realize that at this point, I might get suicidal, then you definitely have to seek a professional help. Until then, there are certain things that you can do at home to remedy the situation. But as I said earlier, once you realize that it's affecting your ADLs, which is activities of daily living, it's affecting your ability to make rational decisions, it's affecting your mood drastically, then you have to seek help.
Thank you so much for that. I believe we are taking a lot of notes and learning a lot as far as this topic is concerned. Now, to Paulina, we've looked at depression. I know that anxiety is also an issue. Okay, so I think Paulina dropped off, so we'll still ask. So Philip, to you, let's talk about anxiety. I know that news about the cases, the deaths here and there is causing so much anxiety in the society. What is your take on that?
Okay. So anxiety, and that is also the #1 leading cause of mental, or the #1 leading mental health condition in the world. So now anxiety manifests in so many ways. Let's talk about some of the signs and symptoms of anxiety. Then we'll talk about in relation to COVID-19 and how it relates. So sometimes when people are anxious, they have sweaty palms, right? Their palms starts to sweat. They might have palpitations, their chest will beat faster. They might have, in some cases, running stomach. And permit me to use some key phrase. When they say that it means that they've heard something which has caused them to have diarrhea.
Yeah.
And it could be anxiety related because of the sympathetic nervous system, right? Now, and then when somebody is also anxious, sometimes they breathe so fast, they tend to be jittery. So those are some of the signs and symptoms. Now, so Paulina mentioned earlier, there are so many forms of anxiety. She did mention OCD and talked about how it could happen because you might already have the compulsion, the thought of, and the obsession, the thought of doing an activity so often. Then now it adds to the compulsion, actually doing it so often, right? So that is one, OCD, obsessive compulsive disorder. Then it could also cause panic disorders. As you rightly said, we're hearing the cases going up so much. People are dying from it. The cases of death keeps increasing. So this can cause someone with underlying anxiety disorder to start panicking about the situation that is going on, especially when someone they love or themselves have to be in a place that is considered high risk. The other part of anxiety, which can also be manifested due to COVID, is social anxiety, right? So now, as part of coronavirus precautions, we are not supposed to be in social gatherings. If I already have phobia about being in social gatherings, and now, due to COVID, it makes it worse for me to be in social gatherings. So I could have social anxiety. And sometimes when we go to church and we realize that people are not taking the front row seat, we tend to be concerned because we want to fill the seats from the front coming to the back. But I might have social anxiety, or I might be claustrophobic, which is the fear of me being in an enclosed space, right? Or agoraphobic, the fear that, and these are all parts of anxiety. Agoraphobic, the fear that I might not have an escape if something is to happen. So by choice, I want to sit by the door. Yet the deacons are telling me to move forward. This may make my anxiety worse, especially given Corona going on right now. I don't want to be close to the podium so that I'll be at higher risk of exposure from the people talking at the podium, whether they are wearing masks or not. It's all in my head, right? Once again, the social anxiety. I don't want to be in the middle of the church. I want to be by where ventilation is very high because we know that the virus moves around. In a closed area, it makes it a higher risk. So I want to be by the door, by the biggest window, so that I'll have more ventilation, and that will give me some peace of mind. Yet I'm being told that I have to move forward. I have to move to this seat. So it might make my anxiety worse. In this case, social anxiety. And it's not just limited to church, but any other social gatherings that one may go to. So these are some of how that the anxiety may show.
Thank you so much for that. I think Paulina is back online. Paulina, welcome back.
Thank you.
All right, so
having a few challenges with the internet.
All right. Before you left, we spoke about depression and we've also spoken about anxiety. I would like to ask you, I know you are on the field and you deal with a lot of cases on a daily basis. I want you to talk to us about how COVID-19 and drug abuse are related.
All right, thank you for the question. Well, for COVID-19, it has rather increased the number of young people who report daily to the OPD with drug issues. Mainly, like Philip mentioned, you are in isolation, you don't have other things to keep you busy, and so you want to make yourself happy. And so most people, or most young people, tend to abuse these drugs. And when we talk about drug abuse, we're not talking about just the weed and the cocaine that we are used to, but other medications. For example, people here have heard that vitamin C and zinc is useful, and so they tend to abuse these medications. For the anxiety bit, they will tend to abuse more of alcohol and other hard, drugs, so they can feel calm and level-headed to some extent. And so drug abuse is on the ascendancy. Young people are doing this to feel belonged, to kill the boredom. And for example, for the OPD cases we have seen, we realized that most young people came in with drug issues, sometimes unknowingly, because they do hang out with friends and they take this coffee or let's say a drink, which is often mixed or diluted with some weed or something high, and they end up in the psychiatric hospital. There is a weed toffee which is also abused. Young people are falling prey to this kind of things on the market. And sadly, that is where we are heading towards as a country. Most of the young people feel that they want to feel accepted by their friends, and so they are abusing this medication or drug on the market. And it's uncontrolled. I mean, it's so sad, but that's the reality on the ground.
Thank you, Paulina. We know that drug abuse is already an issue in the society, but with regards to COVID-19, I want to ask you, per your experience, why do you think someone would abuse a particular drug as a result of COVID-19?
Not exactly. So, like we discussed earlier, COVID-19 is associated with anxiety, depression, and all the other psychosocial issues Philip enumerated. And so people will not abuse drugs just because they want to. They are underlying issues, okay? And so a young person feels that they need to feel accepted. They have social anxiety. They want to overcome that, and so they will abuse drugs. They will do anything to fit in. And so people who abuse drugs, usually when you interview them or you have a conversation with them, you realize that they have underlying issues stemming from rejection at a very young age, and the need to fit in. And also for some, yes, you are a hardworking employee, and you need to take in the drug to make you work harder. There is this energy drink which is very popular here in Ghana now, and people take it with bread. It makes them feel energized. They can work for long hours, and all these have health effects, very detrimental to their health. And eventually, they become hooked on these energy drinks, and they want to have more, and so they abuse other harder drugs, and that makes them very predisposed to abusing very higher drugs, for example, like the weed, the cocaine. Well, there was one on the market, I've actually forgotten, but it also, yes, the tramadol. So, yeah, so it's times from the need to feel accepted, the need to do more, the need to be able to meet the demands of life. And so if you're a mason, or if you are a bodybuilder, or you're doing something that needs a lot of energy, you feel the need to take more of these drugs to keep you on your feet, to help you be able to manage the situation. So basically, if you want to go into why most people would abuse drugs around this time, it is because the anxiety is heightened. Like Philip mentioned, the social anxiety and all the other related issues are heightened around this time. And so they take these drugs for comfort, and it helps them pull through. But sadly enough, they end up with psychosocial and mental health issues.
Right.
Bibi, can you please permit me to add to the why people abuse and its relation to COVID-19?
Okay, Philip, please go ahead.
Okay, so now, first thing, COVID-19 has made people more bored. And we've heard the saying so many times, the devil find works for the idle hand.
Sure.
So as they bored and sit around and, play around stuff, it makes you more adventurous. So there has been this thought of, oh, weed helps you to calm down. Now I'm anxious in relation to COVID-19. Should I try this thing that they've been talking about for all this while? So the devil definitely finds work for the idle hand. So as you sit down, lollygagging around and then entertaining these thoughts, one day you find yourself engaging in it. A patient once told me, and that has been my favorite thing with addiction, you only get high once. The rest you chasing the wind. And that is when I understood when Solomon said, all of this is vanity. Because once you attain that level, anything else will not make you happy. So all that you want to do at that point is, the weed that I took, the first puff, was it enough? Now I have to try second one to see if I'll have the same euphoric effect that I had the first time, and you're not going to get it. So after exhausting with weed, you move on to tramol because that's the new thing. Then you move on to cocaine because that is what is called a big brother. Then you move on to ecstasy. Then you also hear about these concoctions that helps with COVID-19, right? So still on addiction and COVID-19. So you've heard about these concoctions that helps with COVID-19. Hence, you want to jump on it. And in your attempt on jumping on it, you want to throw in something that will give you that euphoric effect. Then you throw it in, and still you don't get the high that you get the first time. So you keep chasing after the wind. And that is what leads you into trying different substances and getting more hooked onto things. So as they always say in addiction, the first thing is not to start. There are so many things that has addictive properties, right? So once you start it, and that part of your brain keeps telling you that you need this to survive, to sustain, and to function, then you're going to continue being on it. The other thing also is this is the time for some people to cash in. And what I mean by that is at this point, certain jobs are slow, right? But certain jobs are of a high demand at this point due to COVID. So for me to cash in and make as much as I can, given the opportunity I have because of COVID, then as Paulina said, I have to stay on these energy drinks, on these drugs, so that I can have the energy to meet the demands of the job, so that when things are to go back to normal and my cocoa season, right, it's over, at least I have cashed in as much as I can from this pandemic.
All right. Thank you for that explanation. I have a follow-up question. You know, with COVID-19, it's like we are our brother's keeper, kind of. So how would I know, or how will I be aware that my neighbor or my friend or my brother is abusing drugs so that I can seek help for such a person?
Okay. permit me to generalize the answer a little bit beyond drugs.
Right.
So how would I know that my brother is affected by this pandemic and therefore may need help, right? I don't know if you want to come back to that later. If not, then if you don't mind, I will extend it to that and then throw in the drugs part.
Please go ahead.
Okay, thank you. So how you would know that your brother or your sister may need help due to the pandemic? One, do you know if the person is laid off because of this pandemic? Two, do you know if the person has limited access to certain things due to the pandemic? It could be grocery, which is food. It could be access to transportation. It could be access to healthcare. It could be access to anything at all. Do you know if they have limited access? The third thing, do you know if they have support? Because one thing that is making it very difficult for us is the support that some of us have lost due to the pandemic. How? One, I used to take my kids to, let's say, my parents' place before I go to work, right? But now, due to the pandemic, my parents are elderly. They are older in age. Hence, they are higher risk. Now, my kids goes to the daycare, and that is also a risk area for proliferation of the disease or the virus. So in this case, we are cautious as a family to expose my parents to the virus. Hence, I cannot take my kids to my parents' place. Do you understand? Yeah. So now that support is taken away. But that used to also be one of the psychosocial support system I had, which I took for granted. Now, do you know if that support is taken away and what can we do to help that brother or sister? Do you also know that that brother or sister now to the drugs is spending too much or more than they would necessarily be spending? Do you know if that person is joining a bad company, right? Because that is how the drug use starts. And then do you know if they have engaged, entertained a thought or anything in relation to substance use or abuse? If you do know any of these, then the question is, what can you do? If the question is, how do I know? Then my answer is, you ask. You engage the person in a conversation. So we're talking about a good friend, a brother, or a sister, which means that there should be that established relationship with the person. I always say, if there's no before, there cannot be an after. So if I don't have that relationship with Bibi, it will be very difficult for me to just call and be like, hey, Bibi, you be smoking something, right? If even I have my suspicion, I have suspicion, I cannot just call and ask that question because that would be a block right there, okay? So there has to be that before. The other thing also is do not go to the person with diagnosis or conclusions. So you don't go and be like, hey, Bibi, you be depressed nowadays. What's wrong with you, right? Because then once you call Bibi depressed, then Bibi just blocks you off because mentally she feels that this person is judging me. But then what I always advise people to do is to go with symptoms. Hey, Bibi, nowadays I don't see you even outside the door. I know Corona is real. We all got to be safe. But at least, you know, you can come out for some fresh air. Then Bibi will get into why she probably cannot do that. That is a symptom that you have observed. Hence, it cannot be argued in most cases. So once we engage the person in the conversation, then it opens up for them to tell us what they are going through. Hey, nowadays, I don't see what's up with the kids. I've been having this challenge with taking care of the kids and work. How are you dealing with it? In actual sense, you may not be the one with the problem, but because you want to hear what your brother or sister is going through with the kids issue, that is how you introduce the conversation, then they talk about it, and then you can help them seek help, right? So those are some of the approaches with which you can tackle the issue of how one is dealing with it, the difficulty they have with the coronavirus and its complications. Then you move on to solutions.
Thank you so much for that, Philip. And I'll come to Paulina. I know that there's this issue of insomnia. that has occurred as a result of COVID-19. Can you please take us through it? Hi, Paulina.
Hello?
Can you hear me, please?
Yes, I can.
Right, so I was asking about insomnia.
That is the person's inability to sleep.
Sure.
Yeah. It all stems from the anxiety we have been discussing all this while. And so there's a need for you to assess whether they are able to go to sleep early or not. Or sometimes they go to bed early, but they don't fall asleep early. And sometimes they would get up, their sleep will be very short, or they could sleep for so long. And so there are variations. I don't really get your question. I don't get it. Could you come again?
So I want to know how COVID-19 has affected sleep. So has it caused a lot of cases regarding insomnia as far as your profession is concerned, since it's your area? Are you seeing more cases of people coming with insomnia, or it's just normal, like how we used to have it?
Well, I can say for a fact that most people are sleeping more, especially when we have the lockdown. I'm talking about Ghana, right? I think lockdowns are still all over the world, but people said they saw every day as any day. And so you could sleep for hours and you wouldn't even know whether it's morning or night. You sleep during the day just as much as you can because you are bored. People started counting ceilings. There were a lot of activities going on online. People were even counting rice. I mean, people did so many things just to get away from the boredom. And so sleep was much. I can't say for a fact that people had sleeplessness. Of course, some percentage of the population would have sleeplessness as a result of fear and feeling of, fear of falling ill or dying, or feeling powerless, in protecting themselves and loved ones. They would also feel they're losing their livelihoods, and while adhering to this physical distancing and all that. And so sleep will not be much for people who have been laid off and still have to feed their families. And there will be a lot of stress for people who are not able to carry out their normal activities like they used to do. And there will be a lot of stress also for them in staying at one place for a long time. And there will also be the stress of the uncertainty about the future, their career, their education, their relationship. So, of course, for such, sleep will be a very big problem. But we don't have data as to whether insomnia has been a problem for most people in Ghana as a result of COVID-19. But for sure, I have mentioned, when you have all this fear and anxiety, you could sleep more or less, depending on where you find yourself. Thank you.
Thank you so much for that, Paulina. The discussion is ongoing. You can send in your questions or comments via WhatsApp line on 0559680066. We are also streaming live on Facebook, on YouTube, on Hope TV GH. I know we are learning a lot, but we would have to go for this quick break. When we come back, we'll continue with our discussion. Please don't go anywhere. Stay tuned. We shall be right back. This is Healthy Living.
Hope Channel Ghana brings you a 5-day church leaders seminar dubbed Leading God's Church from Monday 1st February to Friday 5th February at 6:30 p.m. GMT each night, facilitated by Pastor Anthony Melchizedek, Periodic training, equipping, and empowerment of the human resource of any institution cannot be overemphasized, and this seminar intends to do just that. If you are a leader aspiring to be one, and especially in church leadership, you will not want to miss this. Kindly tune in every day at 6:30 p.m. from 1st to 5th February 2021, only on Hope Channel Ghana, your preferred Christian channel. God richly bless you.
Hello and welcome to Calvary Hour. Calvary Hour is a magazine show that brings your way the beliefs of Adventists and what the Bible says. What do you know about the Bible? Yes, and then you get to meet some personalities who share in their experience. And what makes Calvary Hour an amazing show is that you also get to bring in your favorite songs and we'll play it out for you. Calvary Hour comes your way every Tuesday at 4 p.m. You don't want to miss it.
If you want your business to be very successful, to reach or to have the international flavor, or to transcend to your children and to your children's children and your children's children's children, the best thing to do is to bring in partnership.
You don't need money at all to be innovative.
Right.
But I'm not going to say you don't need money to start a business.
That's
a lot of
right.
people always think that yes, you need money, but even the way you go about even accessing the funds can find a solution in innovation.
Doing business is about taking risk, and risk involves fear.
Okay.
Because you can never tell the end from the beginning, but you still have to do something.
If you spend out of your sales, you run a risk of not accounting for your sales. You may not know exactly how much you have sold and how much you have spent because you are mixing them up.
Meet our subject matter experts every evening on this channel, where we bring your way the Hope Business Forum version 2.0.
Hope Business Forum, Tuesdays at 8 p.m.
Hello, welcome back from the break. This is Healthy Living. My name is Bibi. If you just joined us, we are discussing mental health and COVID-19. And you can send in your questions or comments via WhatsApp line on 0559680066. We are also streaming live on Facebook and on YouTube via our social media handle, Hope TV GH. Before we went on the break, we've spoken at length about the things or some of the mental health issues we are facing as a result of COVID-19. We've spoken about depression, anxiety, sleep issues, and the like. Now, to Paulina, since you are at the mental health setting, I know you have a lot of patients, and when the pandemic came in, you had to teach them hand washing, face mask, and all that. How can one go about that? If I have a sibling at home, a friend, a neighbor, and I need to sit in to do that teaching, how can we go about that in our society?
Okay, so do you mean to a mental health patient or to persons without mental health patients? Because I need to know exactly
mental health patients.
Okay, well, so that brings us to the point that people think that mental health patients are all the ones we see in the streets with tattered clothes and all, but that isn't it. And so a mental health patient who has a good understanding of whatever language you want to use, you sit them down and then you explain to them that indeed COVID-19 is a disease that affects your upper respiratory system, and the signs and symptoms, or how you would know you have the disease, is when you start coughing or sneezing, or you feel your body feels warm to touch, you have headache, and you could also lose your sense of smell and taste. You could have diarrhea, and so you explain the signs and symptoms to them, and then you ask them for feedback as to whether they understood what you said. Then secondly, you talk about the preventive measures. And so for that, we're looking at hand washing, and we say physical distance and not the social distance, because we encourage them as much as possible to keep their social interactions with their family and their friends via the use of internet. It's quite easier now because of Zoom and WhatsApp and other social media outlets. And so for physical distancing, you encourage them to avoid being close to one another, at least a meter or two from one another when they are communicating, and to wear a face mask. Cloth mask is acceptable, and the medical mask is also acceptable. But for clinical areas, yes, we talk about the N95 and so forth. And so you advise, or you try it on for them to see. Usually, if I had known this, I would have covered the face mask. All right, so you put a face mask on this way over your ear. And then when you want to take it off, you take it off this way and you drop it. You advise that you avoid touching your face masks as you wear them, and then avoid adjusting them on your face as well. And if you need to do so, you need to use a hand sanitizer when you are done. For the cloth masks, it's supposed to be worn daily. I heard someone say, "Oh, I love the dark one because you can wear it for days." Come on. It looks like people don't really understand what is happening. The virus
I can probably tell what school they went to.
So you wear the face mask, and then you wash it the same day you use it. As soon as you get home, you wash it. Then we also advise that for their clothing, their shoes, when you get home, you don't come in with your shoe, you leave them outside. And then you can wash later with soap and water, or just a clean cloth with water. And then what else? We can talk about prevention. And so eat healthy. By healthy, I mean a well-balanced diet with vegetables, oranges, that is in vogue now in Ghana. And so they can take that as well. Drink lots of water, warm water, preferably in the mornings. Do a lot of exercise, listen to music. Try not to overload themselves with a lot of information about COVID-19. And they should be good to go. If you let them understand that, of course, a lot of people have been affected by COVID-19, but they are able to survive. And so you should not attach a lot of fear to being infected with COVID-19. Of course, the fear would help you to adhere with the protocols, but you should not go overboard. I think with these things, when you're able to explain to them and practicalize the hand washing, which is also very vital in preventing the spread, by showing them step by step how to do the hand washing, or use of the alcohol-based sanitizer, you should be good to go. For our settings, we have Veronica buckets at vantage points for visitors and for patients, and they are adhering so beautifully. Our only challenge has got to do with the masks. You know, when a patient is very aggressive or they just don't want to wear it, there's basically nothing you can do about it, and that's our challenge so far. But we've been good. And so we can do the education wherever we find ourselves and encourage people to mask up, wash their hands, and maintain the physical distance. Thank you.
Thank you, Polly, for that explanation. Now, we could see that there's a lot of stress in the system because of COVID-19. And as we've already mentioned, people are depressed, people are anxious, people have lost their jobs, and a whole lot of things. So it's causing a lot of stress in the system. I would ask you first, and then Philip can continue with something else if there's anything else to add. Let's talk about stress coping mechanisms as far as COVID-19 is concerned. How can we go about our lives and still live normal lives?
All right. So first of all, I'd like to talk about taking care of you, because you need to be alive first to fight the COVID-19. So there's a need for you to take care of your body, have enough sleep, between 6 to 8 hours, 8 hours preferably. Get a lot of exercise. You can do 20 minutes a day. You do it early in the morning or late, whichever you choose. You need to meditate. That is one thing most people fail to do. You need to switch off the TV, everything, the music, put your phone aside and think deeply about life issues. If as a Christian or as a believer, you could meditate on the word of God, and that's also healthy. Do stretch and do deep breathing exercises. This also helps to calm our nerves and helps us to go through the stresses. And I must say that you must avoid alcohol and drugs. Of course, like we said, it could give you intermittent highness or happiness and make you think that you're better off with it. But look at the long-term effects and avoid the use of alcohol and drugs. And then you also need to make time to unwind from work. Get some music and dance. If you like choral music like I do or classical music, just listen to it and dance and make time for yourself and your family. You should also try to do some other activities you enjoy. During this season, a lot of talent have popped up. I remember there was a guy, is it the GOAT? Yeah. He was all over the place. There was this other song. So you just search within yourself and see things that you can do better. Discover your talents. Get to know who you are. Talk to your close friends and family as well. And then use your social media to remain, in contact or connected with people. Yes, we are to keep physical distance and not social distance. And so call your family, use the video call, see them, let them feel that you still think about it. Call your friends to check up on them. It helps us to cope better with the stresses that is associated with COVID-19. And then lessen the time you spend consuming so much knowledge or messages about COVID. I tell you, it can be upsetting. It can make your anxiety level higher than they were. And then learn some of these coping mechanisms. How do you cope with stress? You need to learn what works for you. How do you cope with anger issues? What works for you? So you need to assess yourself and see how you were able to overcome the stress you had the last time and apply it to your life. Now you need to keep a diary and you write everything that you do, occasionally. You have friends that you need to help with. So you need to have an attentive listening skills. Listen, ask questions. Like I remember Philip mentioned that if you need to know how your friends are feeling, you need to ask them. You need to have a relationship with them first, and then you need to ask them how they are feeling about all that is happening around them. And be empathetic. Put yourself in their shoes. Accept their feelings. Don't go judging them. Oh, but this thing is nothing. Why are you worried? No. You need to accept how they are feeling and also help them to discuss their schedules and then plan their space. Have, a daily planner, and then plan your day so that you don't get bored, especially if you're in the lockdown areas in other parts of the world. Communicate your needs clearly and calmly. If you need someone to help you with something, let them know. If you're not happy about how you're being treated by your partner, let them know. You need to assist in household chores as well. Don't just go sitting and then... I realized that COVID-19 is a bit stressful for us women because, one, our kids were not going to school, we're home, you have to cook several meals a day. And then if you have a partner who is not helping, it can be very, very challenging. And so you need to do that. Lastly, what would I say? I would say have a pleasant company. Call your friends. I think I already talked about that. Be accessible and available for your friends. The more you help people, the more you feel good about yourself. Thank you.
Thank you, Paulina. Philip, to you.
Yes.
Anything you want to add? Then your last words. Our time is fast spent.
Oh, I'll go ahead and add this and crash it for. Paulina said most of it, but I'll start with the ending part. You know, you got to feel good about yourself. And if you notice on my share, you know, it says feel good, right? And I have... Yeah. Oh, let me tell you that a little bit so that people can see.
Oh, right? Okay.
No, I just like to have some sense of humor because this world is so stressful as it is.
Oh, yeah.
So that is one way to start it off. And that is why I was doing that, because I wanted to show what I was going to talk. So one way to help deal with your mental health is to have a good sense of humor. Okay. Because this world is very stressful. This world is very deteriorating, it's very disenergizing. It's all the adjectives that you can give it. So it's very challenging. Let's take off ourselves by having this moment because it helps to release the stress on us. Now, the other thing is you making sure that you understand your baseline once again and know when you're drifting off. Then you can seek help. That is the other thing. Then also reach out to others. There is this thing about helping others. The more you help others, the better you feel about yourself. Because regardless of what is going on, all the challenges you are going through, whether financially, social, all of that, if you are able to find within you to help others, it elevates your mood, okay? Then the next thing, when I was talking about having to work from home and what I did, let me share that quickly. Now, what I did was to find about 15 minutes, go stand outside and have some fresh air, have some breeze, have the sun shine on me. That alone changed my mood for the day. You know, there's something we call seasonal affective disorder, which means that with seasons, our mood changes. So anytime it gets to Harmattan season, for the sake of Ghana, right, our mood will change because nature itself is dying. You realize trees are leaves are falling from the trees. You realize things that comes naturally are falling, right? So it gets to that point where our mood also gets to fall. Hence, with us staying indoors so much and not having the natural light, the natural environment, our mood also falls. Hence, we should make a conscious effort to expose ourselves to nature as much as possible so that we can relate with nature. Nature is a beautiful thing and it's it has healing properties. Now, the other thing is in terms of coping mechanisms, there are certain things that you used to do with which the restrictions of COVID does not allow you to do. You probably love the water. You go to the seaside every so often. Now, due to COVID, you cannot do that, right? But can you do that at home? Let the water run on you for a couple of minutes. Now, water bill is free, so you can do it as long as you need to. Unless Nana has lifted that. I don't think he has. So you can let the water run on you as long as you need to. And then, you know, you get that relief from the hydrotherapy. The other thing also is probably I love to jump, I love to play football or any other sport. Due to COVID, I cannot do those. But in my house, in the confine of my space, what can I do? Probably you can do skipping rope. You can do push-ups. You can do sit-ups. You can do something, other form of exercises which are indoor. The other thing is we've lived with our families for so long, but we do not know our families very well. This is the time to catch up and know who we're actually living with, who our kids really are, who we really are, and all of that. So that in doing all of these, one, we get to know our baseline, two, we find better coping skills, and three, we are able to also have good relationship with our family. I believe as one of the things that coronavirus is teaching us is to make time for the people that we love, because when all things fails, they will be there for us. Mask up, don't man up. Thank you.
Mask up, don't man up. This will bring us to the end of our discussion. Thank you so much, Philip and Paulina, for joining us. We are so grateful for your time. We know that when we call on you once again, you'll be more than ready to join us in the studio or via Zoom to discuss whatever we have up for discussion for our viewers. And to you, our viewers, thank you so much for making time at home to watch us. This has been Healthy Living on Hope TV. We discuss COVID-19 and mental health. If you missed the show, you can watch us on YouTube or Facebook via our handle Hope TV GH. My name is Bibi. Thank you for joining us. And remember, COVID-19 is still with us. Wear your mask, wash your hands under running water and soap. If you don't have the soap or the water, use your alcohol-based hand sanitizers. Maintain your distance if you find yourself in a crowd. And I know that with God, we will overcome. Thank you so much. Have a good evening. Take care. Good night.